Hey, my name is Alanna Warren, and I'm here with my patient who has something to say.
I give consent to be recorded and the video uploaded into a video cloud platform for the exclusive use of assessing the student's competency in the advanced health assessment course at MU.
All right, I'm going to start by taking your vitals. All right, respiratory rate is 16. Pulse is about 66. I do not have a blood pressure cuff. His blood pressure normally runs about 125, 80, 82. Looks like our temperature is 96.9, which is normal. You run a little bit low. All right. So now I'm just going to kind of do an inspection of your respiratory. This patient appears to be in no respiratory distress according to their facial features. There's no nasal flaring. There is no blue or cyanosis of the lips. The patient does not have any barreling of the chest. There is no accessory muscles of the stomach used to breathe or retractions or anything of that sort. So now I'm going to go ahead and listen. So I'm going to have you do a deep cough for me. All right, if you could just breathe a little bit heavier than normal. All right, I'm going to run to the back. Go ahead. All right, no adventitious lung sounds are heard. Lung sounds were clear in all fields. So now I'm going to kind of come through and palpate some of these nodes. Any of this tender? None of the nodes, let me get this one here. None of the nodes seem to be really palpable, warm or tender or anything like that. All expected and within normal range. I'm now going to move on to some percussion. So I'm going to tap lightly on you. I'm going to now come to the back. I'm going to go to about the 10th intercostal space. I'm going to have you take a deep breath. Alright, lung expansion is symmetrical and expected. So now I'm going to have you cross your arms in front of you. Can you say 99?
99.
Bilateral and expected vibrations. I'm going to keep your arms like that. And I'm going to do some tapping. Alright. Now I'm going to listen to the apex of your heart while you're seated, okay? and have you lie down. And from this point, we're going to be looking up here on the part of the patient's head. I'm going to have you slightly tilt your head a little bit that way. So first, I'm going to palpate the carotid artery. No thrill, +2, steady, not thready. And now we're going to look at the jugular vein. So we'll grab this. I'm going to notice the jugular vein because it is got a waveform to it. It occludes. It has a bulge with the hepatojugular reflex. So now I'm going to measure it. On the sternum. Looks like it's about 2.5 centimeters, which is within normal range. Alright, so now I'm going to be listening to the heart. I'm going to be starting to listen at the heart at the right sternal border at the second intercostal space. So listen to the apical region. I'm going to move to the left sternal border at the second intercostal space. So listen to the pulmonic. Move down to the third intercostal space on the left sternal border to listen to Erb's point. Down to the fourth intercostal space on the left side for the tricuspid. And then I'm going to move to the left midclavicular line, fifth intercostal space, and listen to the tricuspid. I'm going to be doing that now. I'm going to repeat the same thing with the bell. S1 and S2 were noted. There was a normal sinus rhythm that matched with his pulse I got earlier. There were no abnormal heart sounds, no S3 or S4 heard or anything like that with the valve or the diaphragm. No murmurs noted or anything like that as well. Now I'm going to feel for the fifth intercostal space along that midclavicular line again for the maximum point of impulse. There's no thrill or heaving noted. No abnormalities of the chest wall here noted either. I'm going to look at your fingernails. And notice that there's no clubbing, that there is capillary refill on both sides. I've already checked the carotid. You would do both sides. I'm going to check the brachial. Both sides. Radial. Both sides. I'm going to palpate for the inguinal nodes here, and you would also check for a femoral pulse, which is kind of hard to do through the clothing here. You would do that on both sides. Popliteal. Here at the dorsalis. Post-tibial, my bad. Now at the dorsalis. Alright, you would do that bilaterally. All of his pulses were +2, no thrills felt, they were not thready, and they were steady. I'm now going to use this microfilament to test his ability to feel. And can tell me when you feel this?
Yes. Yes.
Alright. And I'm going to have you lean over to your left side a little bit so I can listen to the apex of the heart while you're leaning on this side. Alright, I'm going to note the skin is appropriate color to race. There's no sign of cyanosis. There is no clubbing or any edema in the feet. The skin is warm. The feet are warm. Everything seems to be dry and intact. And that concludes this video.